Good morning, everyone. Welcome to the MOTS client entry webinar. It looks like we have most of the people here. There's still some room, but it's a little after 9, so I thought we better get going. Let me see if I can get the webinar going. There we go. Welcome. For those of you new to the MOTS webinar, we do this every Wednesday, every first Wednesday of the month. And we do it from 9 to 10, and we do once a month we focus on client entry of the MOTS system, and the other month we focus a little more on the electronic data interchange, or EDI. This webinar is recorded for those of you who might not be able to make it or get called away from some emergency, some fire to put out. And then you can always find it on our website, and at the end of this webinar we'll have the overview of the information on our webpage, the MOTS webpage. You can find the recording. When you joined us, you also had a small menu popping up, and on that menu there is an option, a section that is for questions, and myself and the team, Jody, Justin, Kayla, and Mary, are here to answer any questions you might have, and then we can kind of type them in. If they're fun questions, good questions, interesting questions, we might bring them to the floor and share it with everybody, so if it's helpful information. So let's get going. The purpose, why do we do this? Well, I might have noticed it, mentioned it a little bit, provide information. And the information is on changes and enhancements of the MOTS system. And maybe in the future, we are going to expand a little more, and others as well. But it's mainly if there are any changes, if there are enhancements, if we're going to add fields, if we're going to change a drop down, if there's some new information that the state legislature starts requiring from our organization, then we'll definitely let you know. Data issues are a hot topic, and we always love to talk about data, but in the amounts of data, the quality of data, and we have a nice platform here to use that. Also very helpful and informative is your feedback. We, of course, work together as much as we can. And if you have great ideas or things that might be a little clunky within your organization, let us know. And maybe we can change the system or help you with experiences that or information that we receive from other organizations to maybe tweak your procedures and processes to deal with the MOTS data and help each other. Another one is get ideas for future webinar topics. If there is something that you always wanted to talk about, or maybe we can bring your information that we have on certain topics that we haven't discussed for a while, or maybe never at all because we didn't think about it, and this is the platform to do it. And again, answer any or all of your questions, hopefully. And if we can't answer your question right away, then we'll definitely find someone within our organization to get them to answer your questions. So, okay, we go back to the agenda, and we're going to start with Kayla Camelli. For those of you not familiar, but Kayla is the new MOTS person, and she's taken over from Lyle Ming, and she is the MOTS system administrator and knows everything there is to know about MOTS because she attended one of my trainings, so she must know everything now, right? Go ahead, Kayla.
Thanks, Pete. So a quick news update, some things we're working on for MOTS. We are currently almost done testing a new user request form that will be an online form, Microsoft form, available online. And that's expected to be done and ready for use in about 2 weeks. Second is our upcoming system upgrade. I'm sure you've heard us mention it before, but we are expected to be starting to build a new MOTS program or an updated MOTS program in the near future, and we will be seeking provider engagement to help us make a system that is useful and easy for you all to use. So just be on the lookout. I'll put it out in the MOTS Messenger newsletter, and we might mention it again in the next upcoming webinars as well, but we will be reaching out for engagement from providers. And then the administrative burden We have no updates, and we hopefully will know more by the end of June. Thanks, Pete.
Excellent. Thanks, Kayla. And then the next one on the agenda is Compass News. As I mentioned in the beginning, Compass, we are the Compass team, and our main focus over the last 10 years has been MOTS because it was new and very big, but things change and we are slowly bringing other systems under the Compass umbrella. So next to MOTS, we have a new system called PGNet, which stands for the Problem Gambling.net. Is the software that it's on, and it is slowly expanding. There are new users joining on a regular basis, new organizations starting to use it. For those of you not familiar with PGNet, but Problem Gambling used to be a paper form that was taken care of by a organization in Wilsonville, and you just send your file or your paperwork there and they would take care of everything. So we build a new system in-house, and it's called PGNet, and it's working pretty good, and we are getting good feedback on it. So the other thing is, the next one is the acute care reporting 2.0, which of course means there was a 1.0, which had been running for the last 2 years, and now we have a 2.0, which is built on a similar backbone as PGNet. It has the same look and feel of that system. So that's kind of like we are sharing platforms to make life easier for our supporting OIS supporting team, and it makes it easier for the look and feel of all the organizations, that it looks more familiar. And the third one is the CLIC system, the License Information and Certification System. It is stable. We had to upgrade from a system called CDB, and it had all the licensing and information, all the programs information in there. And we have a stable system, and we are working on adding new features to improve the quality of the system and the quality of the data, and it make it more helpful to our organization and all the treatment providers that are out there. The other information is the BHDW, the Behavioral Health Data Warehouse. You might have heard about it. It is in progress. It's working. It is in progress to be developed. And hopefully we expect to complete the system up and running by the end of this year. There are several big reports that we need to pull from it to satisfy our federal partners, because as you guys are all very well familiar with, we get money from the federal government, and in return they want information. So, and we get that information mainly from MOTS, but also a lot from the MMIS or Medicaid system. So the BHDW, the Behavioral Health Data Warehouse, is merging that information with some of the ACR, and later on PGNet will also be involved, and the Oregon State Hospital System information. So that will all be in one place. And we can hopefully give an even broader information, and even back to your organization, we can give an overview of Medicaid and non-Medicaid, and the MOTS and the MMIS system, and get even a better picture of what's happening in the behavioral health treatment world. As many of them I've called it the 360-degree view of our patient. That's the ultimate goal, that we get all the different pieces and all the different information parts that are out there, because we know there's different grants, there's different financial streams that require different information. And if we can get that all in one warehouse, then we get a much better picture, a much clearer picture of what's happening out in the behavioral health treatment world. As Kayla mentioned, MOTS replacement is a plan. We are working on it, and we will ask for your information, and we will be approaching you as soon as we have more information, and we might have some dates or schedules. But in the meantime, just keep submitting your data the way you've been doing. Everything is nothing has changed from that part. So, okay, that is the Compass news, and then I go back to Justin. Oregon driver's license format. Go ahead.
Thanks, Pete. Can you hear me okay?
Yep, you sound great.
Thank you. I had to change audio settings in the middle of the webinar unexpectedly. So for those of you who've been using MOTS for a while, you are aware that all clients with a DUII legal status must have an Oregon driver's license number submitted. There is a field in MOTS for that. We wanted to give you some information about how DMV structures the format of that number. It used to be all numeric, 1 to 7 characters, sometimes with a leading 0, which you can see on your screen in the past box. Those numbers in black text were valid Oregon driver's license numbers. Recently, as I want to say 3 or 4 years ago, but it could have been longer, they made a change because they ran out of numbers to the point that the driver's license could be the set of numbers that it used to be, or start with a letter A followed by exactly six numbers. So in the recent box on your screen, you can see the valid and invalid numbers for comparison. That has changed again a little more recently. Now, an Oregon driver's license can start with any single letter followed by 6 digits. MOTS will allow 6 to 8 characters in the driver's license field, but a valid Oregon driver's license is currently 7 characters. Also want to let you know, in case some of you may have forgotten, if you have a client who does not have an Oregon driver's license, perhaps they were driving in Oregon and got a DUII, but they're from Washington or Idaho or some other place, or they don't have a license at all and were driving and got a DUII charge. If that is the case, they will not have a number for you to enter into the system, but you can contact DMV or have the client contact DMV and ask for a DMV assigned reference number that exactly matches the Oregon driver's license format, and you can enter it in MOTS in place of the ODL that they do not have. And one other detail I want to mention, since this is the client entry webinar, we are aware of a small problem in the ODL and SID number fields. You can enter data into those fields, and you can change data in case their number changes, or you put a placeholder in and you want to get the correct number in. But those fields cannot be cleared. If you try to take the number out and click submit, it'll look like it goes away, but as soon as you open that screen again, it's come right back. If you're ever in a situation where you need to clear the SID number or the ODL field, please let us know, and we will do what we can on our end to take care of it.
Excellent. Thank you, Justin. Do we need a ROI to get this info from the DMV? And ROI stands for return of investment? Or is that another ROI? I'm not familiar with the question, so. Do you just call the DMV, Justin, or to get that ODL number?
In my experience, if I needed my number, I could call the DMV and get it without any additional paperwork, except perhaps information about who I am, so I can prove that. For providers, you may need an additional form.
Okay. Release of information. Thank you. I learned something today. ROI. I always think return of investment, or on investment, but it's release of information. Thank you. So you might. We are not sure. Thanks, Justin. Okay, and then we go to Jody, who's going to talk about CMS Code Updates. Go ahead, Jody.
All right. Thanks, Pete. Yeah, so we wanted to just kind of remind folks that, throughout the past couple of years and prior, but the last couple of years, CMS is made and added different codes like ICD-10 codes, which are the diagnosis codes. We've also seen some different procedure codes that have been allowed. So we're seeing these changes are happening way more frequently than they used to. So when you're entering one of these codes, it's typically going to be if you're putting in non-Medicaid services. So once you have your client in client entry with the behavioral health elements and you've got them in with their admit date, then you have the option to add non-Medicaid services, which are the actual which are the actual procedures that you're doing. You know, like, are they in group treatment? Are they getting maybe like a UI? You know, getting a urine analysis. So different things like that. And what we have found is that there's a lot of new ones. So if you're trying to enter a non-Medicaid service for a client and you're searching in the drop down, because usually the drop down boxes you can start typing and look for a diagnosis code or the procedure code. If you don't find one that that you have in your system and that you believe is the correct one for the client, and you can't find it in there, let us know, because most often we need to add that new code. We try and stay on top of them, but with so many changes coming, we kind of depend on you folks to also let us know what we may have missed inadvertently. So an example here would be, the F10.930 alcohol use unspecified with withdrawal and uncomplicated was added last month after we were notified by a provider. So oftentimes that you folks are kind of letting us know when you're getting new codes that are more appropriate or specific for your clients. And again, we really look for you to let us know if you don't see something that you're looking for. And most often, once we receive that, what we do is we validate it, kind of find out when it was put in force and when it was activated. And then we'll get it added to MOTS, and then our MOTS support will let you know that it has been added in there. And then at that point, you should be able to go ahead and get that non-Medicaid service into the web portal and get it updated. So again, a lot of codes have come along the way with the pandemic and telehealth and different things like that. So we just wanted to mention that to everyone in the event that you're searching and you're doing, maybe like you think you're doing something wrong, but it's just not really there. So send us a message to MOTS support and we'll have one of our teammates look into it and see what we can do to get it added and get you moving on your way. So I think that is it, Pete, unless somebody has a question about these type of codes.
No, I did not see anything pop up. Thank you, Jody.
Yeah,
nice.
Thanks.
An ever-changing world. Okay, the next item on the agenda is a very important one, and Mary is going to talk about it, and she's going to talk about closing clients. Go ahead, Mary.
Okay, thanks, Pete. So closing clients, you may have, we give you a list of your clients every month that are still active in MOTS. But it's important that if they're no longer active or they've maybe they left without against a professional advice, or they transferred to another program, or they're incarcerated, or they've completed treatment. All these are reasons why you want to update and close your clients. And it's important to update them first before you close them so that it reflects their treatment. If you closed a client and you say that they completed treatment for a DUI, but you forget to put in the date that they completed the DUI treatment, then you're not going to be able to go back in and fix that date. So you need to update them first. And you need to, and then choose the appropriate inactive status in MOTS. There's a couple of things, maybe if you do addiction treatment, and let's say the client is in dual treatment, their record is showing that they're both in mental health and substance addiction, and let's say they finished their substance addiction treatment first, then you would put zeros in the substance frequency of use and continue to keep the client open until the mental health treatment episode is complete. And then also alcohol and drug treatment providers should use the following rules as a minimum in determining that a client has completed treatment. One, that the client achieves at least 2/3 of his or her signed treatment plan, and 2, the client is no longer abusing or is abstinent 30 days prior to termination. And you can find more information about the inactive status and definitions for each one of them if you can refer to the MOTS reference manual for more information. And let's hand it back to you, Pete.
Thanks, Mary. Okay, back to the agenda. What do we have? Keeping users up to date. Go ahead, Kayla.
Thanks, Pete. We just wanted to emphasize how important it is to keep your users up to date in MOTS. And we know that there's sometimes a lot of movement, but if you have a user or contact that has left your agency, if someone got a promotion and they no longer are the individual assigned to submit data to MOTS, if your agency has changed its name or changed the domain email and that has changed, those are all things that we would like to know so that we can keep the contact information we have in MOTS current, so that if we do need to contact somebody, we can, and so that users who are no longer using the system no longer have access to the system, because we want to make sure that information is protected. So if any of those things happen, just shoot us an email at MOTS support. The form that I mentioned earlier can also be used to deactivate users or reactivate users if somebody has been gone and they're back and they need to get reactivated. That online form can accomplish multiple things, and that'll roll out here in a couple weeks. But for now, just send us an email and let us know, and we can get that information updated. Thanks.
Thanks, Kayla. Back to the agenda, and then we go to number 9 already. We're moving pretty smoothly. Jody, switching from CE to EDI.
All right, thanks, Pete. So this slide is kind of an old standard, but it's good for folks that may be looking to move from entering to the web portal for your data to using an electronic data interface, or interchange is what we call it. So if your organization is thinking of this, sometimes it happens when maybe you're getting a new electronic record system, or maybe your existing system has some functionality now to do this. So a few steps we just want to roll through here is, if you are considering this, please let us know that you might be making a change, even if it's not solidified yet for sure. If you give us a heads up, our MOTS support team and myself, I predominantly support the EDI providers, but I do submit to MOTS their data, but I also do help out with the client entry in our MOTS support team. So let us know so we can kind of get you in the queue and make sure we're ready for it. Number 2, if you are looking at an electronic health records system or an electronic medical records system, and submitting through the electronic method to MOTS is important, maybe ask what the MOTS functionality really means within each of those systems. What is the business process that you're going to have to do in order to use the EDI function? How does the electronic function work from the time maybe you bring a client into service, you enter it into your system, until the actual submission goes to MOTS? That's going to help you identify how much staff time will be required and who's going to do what. There's no one way that is better than another for getting data electronically to MOTS. We just have a set of standards that it has to meet, and as long as that happens, then we're fine. But there's just different ways and differences in how each of the different systems tend to work. So oftentimes there's this, it's not really a myth, but it's a thought that, well, when we go electronic, we're not going to, it'll be all very little or minimalized staff time. And there will, but there are still some items that have to be done. So it's really good if you understand those functionalities of how it works with each one to help you make the decision for what maybe works best for your organization and also for your workflows, your staff, all of those things. So that's just kind of number 2. Takes a little bit longer here to go over, but it's really important. Just, even, just possibly ask for a demo, how it works, so you can kind of see it firsthand. So other providers have mentioned that that's been very helpful for them. So we wanted to pass it on to others that might be going down the same path. After we get through you letting us know of the change, we kind of look at your project, we see what the timeframes are, and we go over that with our teams to make sure we've got everything in alignment and ready for you. We also then will talk about the process for changing from client entry to the electronic data submission. There's a few steps and processes that we put in place there that we'll go through. The 5th thing is that we do set up what's called a Secure File Transfer Protocol setup, SFTP. You may hear that acronym at times. Is basically a location on our servers here at the state where yours either electronic software submits the files or you drop your files off for MOTS to pick up and process, and then MOTS will deliver you back a message, a results file is what we call it, to let you know what was good and what wasn't. So that setup there is important. It's kind of like your own personal mailbox and directory to communicate with MOTS and send your information. Number 6, if your client IDs are going to be changing, we talk about that and we talk about the processes to get them transitioned to the new ones. MOTS support does a lot of help with that, so we kind of talk about that, see what we need to do. It's recommended to just define your business processes. After you see number 2 and you figure out how it might work, then kind of figure out who's going to do what before you go live and when you're getting things set up. And we do test your files. So if you're sending us data to MOTS, we do a test phase first to make sure that everything is coming in as expected. If you are going to a new system and you are picking one that is already submitting to MOTS, maybe with other providers and whatnot, we will still test your files individually because there's so much customization and different things to make the workflows right that we just want to make sure your particular setup with that system, that everything checks out. So we go through a quick testing process. We then go live, and then we do some follow-up. And the follow-up tends to be very helpful. It's just either weekly, bi-weekly, monthly, whatever you feel is appropriate, but just to go over any questions, things that may have come up after you're live and you're actually sending data back and forth and getting information back from MOTS. So those can be as much or as little as needed, but we do offer that as it has been a huge value over the past number of years. And so with that, I think that covers it. Again, just let us know if you're thinking of a change. And we do also have a list of EHR systems that have been submitting to MOTS or that have shown interest. And this is a non-preferential. It's not endorsed by us. It's not anything that, as the state, we are completely independent, non-preferential, but the list is in alphabetical order. It's just helpful if you're trying to make contact and looking. It gives you some contacts for the different health record systems that have been out there and kind of interacting with us. So if you do need that, reach out to MOTS support or myself, and we will be happy to pass that along as just a resource and a tool for you and your project. So with that, Pete, I will hand it back to you unless there's any questions that I need to address.
Nothing popped up that I saw, Jody, so thank you. Excuse me. Okay, so let's get back to and we're already to the final item on the agenda. We have some more room for some questions and answers. As I mentioned at the beginning, a recording of this webinar will be posted on the MOTS website in the training tab. And you can check the MOTS website for past editions of the MOTS Messenger. That's also one thing we do. Every month we have a messenger and we give you some updates and some information and things that might be changing. And we also have one field of the month that is usually brought to everybody's attention just to get a little more specifics. The next one will be our first Wednesday in July, which is the 6th. And the current classroom trainings are still canceled. We have not started them up yet. So we have started talking about it again, but we have not come to a decision yet. So I saw a question about the BHDW. Is the BHDW something that current MOTS users will be using in the future? That is a good question, Maria, and maybe. Currently, it is basically for internal use. It is to help research units get all the different systems together, and maybe in the future, but I have no idea if that's near or distant, there will be a web portal that you can use to, we had one in the, I'm trying to think when that was, between 2005 and 2010, I think, we had a website where you can run some standard reports, or you can kind of mix and match a bit of the data. You logged in, we had some generic reports that came out with some general information about behavioral health treatment. We were working with an IT shop in Washington, and they helped us set up something like a web portal for our treatment providers to look at information per county or for all over the state. There were some standard reports that we create for the federal government and the Oregon legislature and management that a lot of people, and especially on a county level, thought were very helpful. So maybe, it's always still a maybe. We might have a portal like that, which will be looking at the behavioral health data warehouse. So that's all I can say at the moment. Okay, and then we have one more screen, which is the information from everybody. So thank you for joining us. There are all our emails. If you have any questions, want some specific on something wasn't clear, our MOTS website is always there, oregon.gov OHA/AMH/MOTS. And of course, the support team is always somebody watching that mailbox, the mots.support@dhsoha.state.or.us. Okay, thank you all very much and have a wonderful rest of your day.